everyone. In today's class, we are going to discuss a heart lung machine. So, in this class or in this video, we are going to explore what is all about heart lung machine and how does it being used during cardiac surgery. Okay, let's start with the basic definition, that is what is a heart lung machine. So, heart lung machine is a machine which is going to take over the functionality of heart and lungs, especially during a surgery which is being related to heart. Okay, so this device will act as a temporary replacement, not permanent replacement. So whenever there is a need to do any kind of or any sort of surgery in the heart, then we will go with this option called heart lung machine. So the common use of this heart lung machine will be coronary artery bypass, valve repairment, or heart replacement, because these common use like these application is needed for the functionality of heart to be maintained, so that all other vital organs will be alive without any malfunctionality. So to have a maintaining of other organs to be alive, again we need a functionality of a heart function that will be taken over by this heart lung machine when we want to perform any sort of surgery in natural heart. Okay, so there is one person which is especially in this case, that is heart lung machine, or the one who trained or will maintain the functionality of heart lung machine, that is the perfusionist. So the main job of this particular clinician or the this perfusionist is to ensure or monitor the proper flow and oxygenation is happening in the blood. Okay, so perfusionist is the one plays a vital role in handling this heart lung machine in order to have a smooth mechanism of heart lung machine to have a proper oxygenation and proper flow of blood. Okay, so next we will see a small introduction about normal heart and lung function, because already you know how does it heart works, what is the main purpose of this, and how does it lungs work, and what is the main purpose of it. Just I'm going to give you a glimpse of a few basic function of these heart and lungs. So you know the heart is a vital organ. It will do pumping mechanism. So it will pumps nearly 72 beats per minute. It for by through either pulmonary circuits and systematic circuits. You know what is the meaning of pulmonary circuits and systematic circuits? The pulmonary circuits, it's the circuit through which the deoxygenated bloods from all over body will take over, and then go to and then it goes to heart. From the heart it will goes to lungs for the purification, that is the oxygenation. And systematic circuits is it's a vessel, that is a blood vessel which will carry out the blood, that is the oxygenated blood, from the lungs and then to heart, from the heart to all throughout the body. So through these two circuits, the deoxygenated blood will get oxygenated and will get circulated all over the body. Okay, so that is the thing I have mentioned here, that is the pulmonary circuits, that is a deoxygenated blood to the plums, and systematic circuits, it will pass the oxygenated blood to the body tissues. And what is the role of the lung is nothing but it will have oxygenation process. It means that whatever deoxygenated blood is goes into the lungs, all the way it will travel two lobes of the lungs. Finally it reach alveoli, through around which the alveoli, the capillaries, that is blood vessel end of the blood vessels will be innervated. Through the capillaries the oxygen exchange process will take place. It means that from capillaries the O2 will goes into that is now O2 will goes into capillaries, and from I mean CO2 will goes upwards. So through which the oxidation process, that is oxidation process will be take over, that is deoxygenated blood is getting into oxygenated blood, that is impure blood is getting into pure blood. So this is how the oxidation process will be taking place. So this is the natural heart and lung function. So next we will move on to what is the role of heart lung machine. So the main role of heart lung machine, from the name itself you can easily guess it. The heart, it will going to mimics, that is the heart lung machine. In that word, the heart is going to mimic the natural heart, and the lung is going to mimic the natural functionality of natural lungs. Okay, so the main role of heart lung machine is it's going to circulate the blood, that is going to pump the blood from deoxygenated blood to again back to the body. That is from outside external to in to the inside of the body. And the lung is going to main functionality of the lung is oxygenation. So here the heart lung machine have one component oxygenator that will going to purify your blood in terms of enriching with oxygen, removes the carbon dioxide externally. So these are the two vital role of a heart lung machine. One is heart functionality, another one is lung functionality. That is a pumping mechanism that which enables the circulation of blood easily into the body, and second one is oxygenation. And what is the third and fourth role of this particular heart lung machine is surgical enablement. Because of this support, heart lung machine support, we can able to do the surgery in the heart. Unless until we can't do surgery in the heart if there is no support of heart lung machine, because the heart lung machine for the meantime is going to take over the functionality of the heart and lung, so that all other vital organs will not have any malfunctionality. It's no way going to get affected. So at the same time we can do operation, or we can do any kind sort of surgery in the heart without any discomfort or without any problems. So the fourth main role of heart lung machine is the temporary use, because this is the machine is going to act for a temporary case. The reason is that it will only support the patient circulation only for few hours during the operation. So we can't use this for a 24/7. It is not a permanent, or it cannot be support for 1 or 2 days, just for temporary use for the time being that is operation is being carried out in the hospitals. Okay, for a short meantime, for example only for few hours. So these are the main role of heart lung machine. So next we will move on to what are the key components of the machine, because the heart lung machine have a main three few key components, that is the hardware components. First, if you see the pump. Second key component is the oxygenator, and third one is key exchanger, and the other few additional components are there, that is the accessory components. So first is the first one is the pump. You know already what is the meaning of pump, right? It's just going to pump out the blood circulation. It means that it will ensure the proper circulation of the blood from the body to the machine, and from the machine to the body. So it's going to replace the heart functionality. Okay, the heart what is doing? It is carrying all the deoxygenated blood from the body and it giving to the lung for purification. Again from the lungs, it's going to take away all the blood from the lungs. That is a purified blood, and then again it's going to circulate to the all throughout the bodies. So this heart functionality is going to replace by the components called pump. And the next key component is the oxygenator. So this is going to take over the functionality of the lungs, because inside the lungs the oxygenation process will carried out. Here also inside the oxygenator the impure blood will get purified. That means the deoxygenated blood will get into oxygenated by enriching with oxygen. Okay, the third one is the heat exchanger, because this is very important. Whatever the blood is coming from body to the external environment, so there will be a temperature difference, because our core body will have some sort of temperature, and outside environment will have other sort of temperature. So this mismatch of temperature will lead to some other consequence or some other side effects. In order to avoid this, we have that component is called heat exchanger components, which will control the blood temperature during the circulation. It means that it will maintain or ensure the body core temperature, so that there will be no side effects will occur because of this temperature variations. And in addition to this, we have so many other components, that is the cannula tubing. Yeah, these are the tubing which is being inserted into the either vena cava or into the aorta, in order to get deoxygenated blood from the heart, and also to give the oxygenated blood to the aorta. So for that we need a cannucula, that is a tubing like component through which the blood will be travel, or the blood will be passage will pass through it. Okay, second one is reservoir. So the reservoir is nothing but it's a like it's like a chamber with a top hole and bottom hole. So through top hole, the blood will poured into this container that is a reservoir. It's being collected, and then in second hole that is a bottom hole, and then through which the blood is going to a heart lung machine for the further processing. So the reservoir is something it's going to ensure enough amount of blood. It will store the enough amount of the blood in order to ensure the proper functionality of heart lung machine without any discomfort. Okay, it will ensure the 100 percentage functionality of heart lung machine. So and then filters and bubbles, these are the other additional components or the parts. These filters and bubbles will remove the airs or debris in case if it is there, because the air will end up with some potential risk like air embolism or gas embolism, which will lead to some stroke or some other problems. So the filters and the bubbles will take over those things. It will prevent these sort of air bubbles or debris from reaching into the body. And last one, it has the option of monitors through which we can have a track of what is the vital parameters, whether it is in under the limit or beyond the limit. And we have other sort of alarm also, which will alert the physicians or the operators to have proper functionality. So these are the key components of machine. In next class, we will discuss what is the normal mechanism or working principle of heart lung machine in detail. Thank you.